Hi there, it's Ed Thompson here from Instant Physio. Today we're going to talk about the biggest mistakes that you can make with a running injury. Now, we're going to dive straight in, but first I do want you to hit subscribe. That will make sure you get alerted next time we're doing a really cool video. So let's get started. So the first mistake you can make, let's say you've been for a run, your knee started hurting or your ankle or your shin or something like that, and it's starting to make you concerned. Maybe it's actually stopping you from running, or maybe it's stopping you enjoying running, and maybe you've got a race coming up that you're concerned about, and the clock's ticking, and you're making yourself kind of worry a little bit, or it's a longer term issue and something that you've been dealing with for a while that keeps coming back. You might rest, the pain goes away, which is great, and then it comes back as soon as you go back out on your first run. Or there might be just a limit to how much you can run. So every time you run more than 7K, that little injury just rears its ugly head. And again, we're going to just talk through some of the key mistakes to avoid. So the first one is panic. We don't want you to panic when you have any kind of injury. And what's important to remember is running injuries are really common. And if you're active, just being injured isn't uncommon, and it isn't something that we need to be drastically, really frantically worried about. A physio I used to work with used to say, you're in pain if you don't exercise, and you're in pain if you do exercise. But obviously, there's all sorts of benefits and lots we get from exercising. So it's a risk that a lot of people take because of those benefits. But it's just important to remember that pain from running would tell you that what you're asking your knee to do, or whatever it is that you've hurt, is more than it can tolerate. And it sounds simple, but it's just important to understand that concept. And it's just feedback. Sometimes we say pain is the policeman of the body, and it's just feedback to say this is too much and this is more than you can tolerate right now. And the vast majority of running injuries can be dealt with in physio by a running specialist. And again, it's a reason to have confidence, and not make rash decisions like panic buying things, or trying to do things on a sort of radical scale. So know that it's normal, and know that it can be helped as well. So the second biggest common mistake that people make is ignoring it. Let's say you've got into running recently, or you got back into running, or you just love running and you have done for a while. You got into a good routine and you feel good, your mood's good, your energy's good, you're eating well. It has all sorts of rippling effects when you get into running, and it's a really, that's why it's such a popular sport and hobby. Or you might have a race, and that's something which you've been working hard at. You feel like you're making good progress. You're working towards a PB. You've raised some money perhaps, or it's just it's been on the bucket list for a while, and you've actually really kind of set a lot of time aside to do this training program that you've been working on, and then something starts to hurt. Now, normally more competitive people, this can be the biggest mistake they can make, is where they just ignore it. And it's because the pain of stopping is greater than resting, to allow it to settle, or treating it, or whatever it needs to happen for it to go away, basically, and which normally does involve reducing how much someone runs. So ignoring it is the second biggest mistake people do. They plow on, they keep going, keep pushing, and then that risks harming the problem, harming yourself more, and basically increasing the length of time it will take to get better. So number 3 is rest. Now I know I've just said don't ignore it, which means just back off a little bit, but now I'm saying don't rest either. Obviously, there are injuries that do require rest, which is why I'd recommend that you see a healthcare professional to get that advice on what's appropriate. But what can be a mistake is when we experience a small amount of discomfort, or just we get that feedback that we're doing more than your body can tolerate, and then you sort of rest for 6 weeks. And yes, the pain might reduce, but your conditioning to running is going to reduce as well, and therefore the journey back into running is going to take longer, and there's all sorts of risks involved with irritating the injury again when you do. So reducing volume is normally what we do in some way. So someone might say, yeah, I run 3 10Ks a week, and because it hurts on the third one, I'm just going to stop and rest for 4 weeks. And it's a massive reduction in what that person's doing. So therefore, that conditioning that we get from regular running is stopped. So the injury does get better a little bit, but it takes then a long time to get back into running. So what we would recommend is reducing the volume in some way, shape, or form, based on what the injury is and based on the individual. So to say how much by is not a good idea to do over YouTube. I would recommend you get advice on that. Number 4 is Googling your symptoms. Dr. Google is good for some things, but no one comes away from a Google search feeling better, as one of the physios who I work with says. And another physio used to say 6 clicks and you're dead, which sounds a bit radical, but it might give you some peace of mind sometimes, but particularly for runners, it's a dangerous game to play, because you might go off on a tangent which is totally irrelevant to your particular problem. Like you've read a blog, and this runner said really confidently, I foam rolled my IT band for 5 weeks and it fixed my knee. Who knows, you might do that for 5 weeks, waste 5 weeks, and it's just a huge waste of time. And it's kind of unsolicited advice, really. It's like, I'm trying to think of the similarity between when you're trying to navigate somewhere. Say if you're in London, you're trying to get to York, which is where I'm from. It's just not giving you specific enough information. It's kind of like, go head north, it's that way. But in physio, for example, with a running specialist, you're going to get the postcode, you're going to get the what 3 words, you're going to get the door number, and that's the difference, really. So it might give you a general direction, but it's not going to give you the real specific fastest way to get better, basically. Same with YouTube. That's number 5, maybe 6. This is really important because, again, it can send you down a rabbit hole. You can follow different people who claim to be able to fix your injury with various different stretches, but it's unsolicited. It's not specific to you. It's kind of like a GP saying, I know you're ill, so here's the keys to the pharmacy. Have a look around, just grab whatever you think looks good. Take as much as you like for as long as you like, and let me know if you have any issues. It's kind of like that, basically. And again, you might get some common sense and some peace of mind and some clarity, but I wouldn't advise it for someone who wants to get better in the fastest and safest time. The next one is see your GP. Now, in fact, it's not see your GP. It's something else. So I was going to originally put see your GP, but there's no harm in seeing your GP. Do that. I wouldn't recommend not doing that. But what I would caution against is listening to their advice too intensely, because rest, painkillers, and wait and see aren't good for runners. And rest, wait and see, and pills generally is going to be good for the pain, but not good for the runner in terms of getting back to running. So GPs are very good at keeping you alive. They're very good at saying what is threatening your life. But beyond that, it's going to be general advice that that you're going to get. And they may say, we'll send you to physio in 6 weeks if it doesn't get better, which again is very frustrating as a runner, because that means more time on the waiting list. And again, not really having any clarity on why it hurts and what they can be doing proactively to get it better themselves, rather than just kind of sitting and waiting at home. So the next one is buying new trainers. Buying new trainers is the number one first thing that someone does when they hurt themselves. And I think it's largely down to how good the campaigns are for Nike and all the different shoe companies. They make it seem like footwear is going to fix all your problems. And my view is that good footwear may well help with reducing the likelihood of an injury, perhaps. But I wouldn't ever use it for treating an injury. It's a bit like spinning in a roulette wheel. It's kind of, it might help, it might not. And as a scientist, as a physio, we don't like those types of solutions where it's a bit of a sort of kind of finger in the air type of treatment. And I would also say this, that if there's antibiotics that help you get better when you're ill from a doctor, so you've got flu and you take some antibiotics, you feel better, to stay better, continuing to take those painkillers, those antibiotics, isn't going to be what stops you getting the flu again. And it's the same concept, the running shoes, if you choose the right ones, they may well help reduce the risk of injury perhaps, but they wouldn't be used for treating the injury. So it's a bit like when patients come to us with really bad back pain and they say, I've been doing yoga and it's not helping. And that, again, for me, it's because yoga is preventative. So when someone's out of pain, or maybe their last 20% of their symptoms are gone, or still just the end of their treatment, that's when yoga might help and be suitable. But to treat acute back pain with yoga isn't appropriate. And it's the same concept. If someone's ill or there's disease like an infection, or you've got some sort of illness, then what's used to treat that illness is not the same as what's used to prevent it. And it's really important to get that concept clear, particularly for runners. So on the topic of footwear, I know that I said that I would give you a bonus tip. Now, there's certain types of footwear which might reduce stress through the knee, for example. So a flatter shoe might mean that you run more on the forefoot, more on the midfoot, and make the calf do a little bit more of the work and the knee do less. But what's important to know is that what we can't do with footwear is take away stress. All we can do is move it. So the knee does less, but it's like a seesaw. Somewhere else that load and stress has to go somewhere else. So yes, we're reducing pressure through the knee if we're with a flatter shoe, with a smaller heel, but the ankle and the calf are going to have to work harder in that situation. So it's important to bear that in mind, because radical changes in footwear is where runners come undone, and often that can be the source of a lot of issues when it comes to footwear and injuries. Radically changing your footwear is something that can be an issue and can be the root of a running injury. So if you're looking at ways of reducing stress through the knee, then that would be something I might consider, but I wouldn't, again, use it to treat knee pain, really. So the last tip that I'm going to give you on this talk is about marathon runners. So maybe you've got a race, maybe you've got a fun run, maybe you've got just something small, or you've got a marathon and something quite big that you've been planning for a while. And the only difference between the runner who's hurt themselves, who doesn't have a race, and the one who does have a race and something coming up is the time pressure. And in essence, just the pressure, because there's a huge amount of pressure associated with certain types of races and events. And someone could raise money, someone could tell all their friends, and they've all booked tickets to come and watch them. They've been training for months to get in shape, and now this last month before their race, they've hurt themselves. And there's a lot of pressure that mostly comes from the runner themselves. So that's what I always say to our runners, that most of the pressure that you're feeling right now about this injury and the race and whether you need to defer it is actually coming from yourself. And if you can just cut yourself some slack, that might help you make a better decision. Now, this goes on to my last point. Now, all of these points that I've raised, all the mistakes that runners make when they hurt themselves, can all be avoided by seeing a running specialist physio. So a physio who's spent the last 8 years specializing in the study of running injuries is going to be the best solution for that runner to get better in the fastest and safest time, compared to a normal physio. Who a friend came to see me recently, and they said, my physio said after my knee had settled down, go out for a run, see how it feels, shake it off if it hurts, have a go the next day, and let me know how you get on. Now, this is really bad advice, and that's because that that physio is a generalist and hasn't spent time studying the nature and the science and the in-depth understanding required of dealing with running injuries. And that's the difference. Those small conversations around returning to running or doing certain exercises or doing certain treatments, and those small iterations can have a huge impact on whether a runner gets better in a month or 6 months. And lots of patients have come to see us after 3 years of physio in 4 different practices, and they've just been doing the wrong things. And it's frustrating, but good that we've finally been able to get them the right help that they need. For example, a runner had shin pain for 2 years. He'd spent £600 on 3 pairs of shoes. I'd had 3 courses of physio, which involved massage and acupuncture and dry needling and orthotics and insoles and strength and conditioning and squats and things like that. But actually, the solution that we found was actually in how he was running, and that was the biggest issue with why he'd not got better. We did get him better. He knows how to keep it in check. He's running a marathon this year. We haven't heard from him since, and simple things like that to us are kind of just not even in the sphere of some generalist physios who don't deal with running injuries every day. So Instant Physio offer free discovery sessions. We have 5 per week, and they book it really fast. They're basically a chance for you to visit the clinic, come and meet the team, see the clinic, have a tour, sit down with one of the physios, and we'll get to know you. We'll talk to you about some of the people we've helped in the past. We'll give you a little bit of an action plan of what we think treatment might look like for you. And that's because we think it's only fair for you to come and try us out before charging you for any sessions, basically. So we want you to be happy, confident, clear about what to expect. We're working with us, and after that, that's when we can start treatment and getting you better and back to running. So I hope you found today useful, and I'd like you to leave any questions in the comments box or send me an email. So thanks again for watching.